Most TMJ diagnoses are wrong, and I'm going to show you why. I am a dentist, a licensed physician, and a specialized surgeon. The patients I see aren't just in pain, their thoughts are being bombarded by debilitating agony from their jaw all day long. They can't relax. It feels like it never turns off. You may be one of those cases. You may have tried the night guard or tried physical therapy. Maybe you were told Botox might help, and you still wake up and your jaw is already tight before your day has even started. Which tells you something important, that you're not dealing with one clear problem. I am Dr. Tim Batida. I'm an oral and facial surgeon. I've treated thousands of patients who walked in with that TMJ diagnosis, and I started seeing a strong pattern. There are two completely different problems hiding under the same TMJ label. And once I understood that, everything about how I treat these patients changed. But here's what I got wrong early in my career, and what I still see most practitioners miss. The thing that separates those two problems is not just another scan or an x-ray. It's that most aren't even asking the right question. I'm going to show you what those two problems actually are, how to figure out which one is yours, and why getting that distinction right is the only thing that determines whether your treatment is going to be successful or not. Point one, first things first. Is what you have related to your TMJ or jaw, or is it related to something else entirely? To figure out whether it is related to your TMJ or jaw muscles, or related to something else entirely, there are 6 questions you should ask yourself. This short questionnaire has a 99% sensitivity to find out if it is related to TMJ issues in or around the joint. I'm going to ask you the 6 questions. A no response is worth 0 points, and a yes response is worth 1 point. Question 1. In the last 30 days, have you had pain or stiffness in your jaw when you woke up? Give yourself a point if yes. In the last 30 days, did the following activities change any pain? That is, make it better or make it worse in your jaw or temple area on either side. Give yourself a point if chewing hard or tough food caused a change in the pain, made it better or worse. Give yourself a point if opening your mouth or moving your jaw forward or to the side caused your pain to change, made it better or worse. Give yourself a point if jaw habits such as holding teeth together, clenching, grinding, or chewing gum changed the pain, made it better or worse. And give yourself a point if other jaw activities such as talking, kissing, or yawning changed the pain. And last, in the last 30 days, on average, how long did any pain in your jaw or temple area on either side last? 0 points for no pain, 1 point for pain that was very brief but no more than a week long and it did stop, or 2 points if you had pain and it was continuous. Now, add up all of your points. If you scored 3 or more, there is a 99% chance this is related to what we are talking about today. If you scored 1 or 2 points, it could very well be related to something else like migraines or earaches or something else entirely. But for those who scored 3 or more, it is highly likely that you will find value in the rest of this video. Point 2, the word TMJ is making you sicker. When people hear you have TMJ, they assume that you have been given a diagnosis. Their dentist said it, their physician said it. They Googled it and found pages upon pages of information about it. So it must be a real thing with a real cause and a real treatment. Physicians and dentists started using TMJ as a shorthand for any kind of jaw pain decades ago. And it stuck, and it's on insurance forms, it is in clinical notes, it has become the word for something is wrong with your jaw. And because everyone uses it, everyone assumes it means something specific. TMJ literally stands for temporomandibular joint. That is just the name of the joint itself. Saying you have TMJ is like saying you have a knee. It tells you where it is. It does not tell you what is wrong. And because 2 very different problems live in that region of your face, using one label for both means that half the people who get treated are being treated for the wrong thing entirely. You have not been given a diagnosis, you have been given a location. But what are the 2 main categories of problems that it could possibly be? Here's where it gets strange. Those 2 different problems can feel very similar from the outside, but they require completely opposite treatments. So what is the difference? There are 2 things that can cause what gets called TMJ pain. One is a problem inside of the joint itself. The other is a problem in the muscles around the joint. They feel very similar, but they are not the same thing, and they do not respond to the same treatment. Up to 85% of people who came in with what they were told is a TMJ problem actually have a muscle or a nerve issue, not a joint issue at all. That means many people walking around with a TMJ diagnosis may be treating the joint for a problem that they do not have. Once you know which of the two things you actually have, every treatment decision becomes clear. The guesswork stops. You stop siphoning through things that were never going to work in the first place. So let me show you what each of those two things actually looks like, because the way they show up in your life is different. And that difference is something you can start identifying right now. Point 3, problem 1 is inside the joint. Problem 2 is around the joint. Most patients assume that if the pain is in their jaw, something must be wrong with the jaw joint. The bone, the disc, the socket, something structural must be broken or out of place, and that is what needs to be fixed. It makes logical sense that pain in or around the joint could be a problem within the joint itself. And for some patients, that is absolutely true. But the joint is surrounded by a dense network of muscles that move the joint itself and nerves that run adjacent to it. And those muscles and nerves can generate the same sensation of pain and tightness as a damaged joint would. When you treat a muscle problem as a joint problem, you are focusing on the wrong issue. Certain night guards offload pressure from the joint, but if the disc is fine and the pain is coming from an overworked muscle, the guard may not touch the real source. You might get temporary relief sometimes because you are changing how the bite fits together, but the muscle that is actually causing the problem keeps going. You cannot fix a muscle problem with a jaw joint treatment. It does not matter how good the treatment is. But this is where it gets counterintuitive, because the two problems can look almost identical from the outside. The pain is generally in the same place. There may be clicking sounds in either case. So how do you tell the difference? The answer is in the details of how the problem actually behaves. Joint problems, which we call internal derangement, have a specific pattern. Muscle and nerve problems have a different pattern altogether. Think of it this way. Your TMJ has a small disc sitting inside it, like a little shock absorber. And that shock absorber is between the two bones of your skull base and your jawbone. When that disc slips out of position, you get a popping and a clicking. When it locks open, you get a jaw that will not close all the way, and this is called an open lock jaw. When you cannot open your jaw all the way, or opens only slightly, it is called a closed lock jaw. The disc may be acting like a doorstop inside your joint. This is an internal joint problem. Pain is usually pinpoint right in front of your ear. Now think about a muscle that is in chronic spasm because you have been grinding and clenching for years. That muscle is tight, tender to the touch, and it refers pain to your ear, your temple, or even your teeth. No disc is involved, no joint is damaged. It is the muscle that has been working too hard for too long. There's inflammation there, and there is muscle tenderness in the temple area on the side of your face or jaw. This is a muscular problem. So in the next section, I'm going to give you the questions you can ask yourself right now to figure out which category your pain is most likely falling into. If you are new here, I'm Dr. Tim Matita. I'm a board-certified oral and facial surgeon. My journey in training took me through dental school and medical school, which means I am both a dentist and a medical physician. And I have spent my career treating the cases that did not get resolved somewhere else. I tell my patients exactly what they need to know. Subscribe if you want straight answers from a surgeon who fixes problems when other treatments did not work. Point 4, how to tell which problem you actually have. You have probably tried to describe your jaw pain to a physician or a dentist and felt like the words were not quite right. It clicks here, it aches here, sometimes it locks, sometimes it just feels tight, and you just leave the appointment not entirely sure whether they understood what you were describing, and not quite entirely sure you understand it yourself. There are specific patterns that separate internal joint problems from muscle and nerve problems, and they show up in things you have already noticed about your own pain. You have the information, you just have not known what to do with that information. Here are some questions to help you organize your thoughts. When your jaw clicks or pops, does it always click in the same spot when you open or close? Or Does the click happen at different points during the movement? A joint disc that has slipped tends to click at a consistent point in the opening path, like it is snapping back into place. A muscle pulling inconsistently does not produce that same reliable pattern. Another question: when you press gently on the muscles along your jaw or at your temple, do you find spots that are tender to the touch? Muscle problems almost always produce what are called trigger points, specific spots in the muscles that are sore when pressed. If pressing on those spots recreates the same pain you have, you are more likely looking at a muscular problem. Another question is, has your jaw ever locked open or closed, meaning it physically would not move in one direction or another? Locking is a strong indicator for a joint disc issue. Muscles can limit movement because of tightness and pain, but locked jaw where you genuinely cannot open or close fully is much more characteristic of an internal joint issue. If you answered yes to the second question and no to the third, you are likely dealing with a muscle and a nerve problem. That is actually good news, because those are cases that respond best to conservative treatment. If you have locking, if the clicking is very mechanical and consistent, and if the pain lives right inside the joint, right in front of the ear, you may be dealing with a joint issue that needs a closer look. Either way, knowing which category you are in is the first step to getting the right answer. And here's where most patients lose years, because once they know which category they are in, the next question is what to actually do about it. Point 5, the sequence of treatment is not optional. The thing that tells you which problem you have and what to do about it is not necessarily a scan. Scans are very useful, but more important is a proper clinical evaluation by someone who understands both categories, knows what to look for in each one, and is not going to hand you a diagnosis before they have actually figured out which diagnostic category you fall into. This matters right now because many TMJ patients I see have already been in the wrong treatment lane for months and sometimes years. And every month you spend in the wrong lane is the month that the actual underlying problem either stays the same or gets worse. The joint does not improve on its own when it has a disc that's dislocating all the time. And the muscles do not stop triggering when they have been in spasm for 2 years without being properly treated. Many of my jaw pain patients are women in their 20s, 30s, and 40s. They have high-stress jobs like nurses, teachers, and mothers. They've been clenching and grinding for years, and they've been under pressure they cannot always name. By the time they get to me, TMJ, specifically the joint treatments, have failed them, and some of them have been told the next step is surgery. In most cases, major surgery is not necessary. For most, the problem is muscle-driven. It has never been a joint-specific issue for them. What they needed was someone to properly separate the diagnosis before jumping into the hardest treatment. Stop accepting a TMJ label as if it was a complete diagnosis. It is not. It is the beginning of a conversation, not the end of one. Ask whoever's treating you one specific question. Is this a joint problem or a muscle problem? And ask them to explain how they know the difference. If they cannot give you a clear answer with a clear reason, that tells you something important about whether the treatment they are recommending is aimed at the right target. And if it turns out that your problem is on the muscle side of that line, there's actually a lot you can start doing right now at home before you ever see another specialist. That is what I want to leave with you today. So point 6, if you have a muscle problem, start here tonight. Muscle-driven jaw pain responds well when taken seriously as a muscle problem. That means reducing the load on the muscles, increasing blood flow to them, and breaking the cycle of tension that has been building up often for years. These are not complicated interventions. They are the kind of thing that starts working in the first week if you are consistent about it. Think about what happens when you hold a weight out in front of you for an hour. At first, it's easy, but after an hour, the muscle gets fatigued and starts to hurt. The muscle is not damaged, the shoulder joint is fine, but the muscle is fatigued. It is tight and it hurts. The fix is not surgery. The fix is rest, warmth, and movement that loosens the tension. Your jaw muscle works the same way. They have been holding tension. They need to be told it is okay to let go. Most of my patients who start with conservative care at home begin to notice real reduction in pain and tightness within the first 10 days. Not full resolution, but enough improvement that they can feel which direction they are moving. And that matters because when you feel improvement early, you know you are on the right track. Here's where to start tonight. Put a heating pad on the side of your jaw and on your face, maybe 10-15 minutes. The warmth increases blood flow to the muscles and helps break the spasm cycle. This is one of the simplest and most underrated things for muscle-driven jaw pain. After the heat, gently massage the muscles along the side of your temple area and your jaw with light circular pressure. You are looking for tender spots. When you find them, do not press hard, just gently massage with light pressure for about 1 minute in each spot, and then relax, and then go to the next spot. Repeating this multiple times for about 1 minute per spot really breaks up that muscle tension and relaxes the muscle even more. Next, throughout your day, check where your teeth are. They should not be clenched tightly together unless you are chewing. Clenching and bracing your teeth together all day is one of the primary drivers of muscle fatigue. Every time you notice contact, relax and let the facial tension go. Avoid chewing hard foods and avoid chewing gum for the next several weeks. You are asking an overworked muscle to do less work. That means not giving it more weights to carry while it is trying to recover. And try sleeping on your back if you can, or at least avoid sleeping face down into your pillow. That position loads one side of your jaw all night and compounds the problem. TMJ is not a diagnosis, it is a starting point. If you leave this video with one thing, I want it to be this. Before you do anything else, find out whether your problem is in the joint itself or around the joint. That single question changes everything. The treatments are different, the timeline is different, and the chances of actually getting better are completely different, depending on whether someone answered that question correctly before they started treating you. If you are watching this for the first time and you want to understand what the path forward actually looks like before you walk into another appointment, watch the first video on this channel. It will show you how I actually think about treatment decisions from the very beginning, and it will help you ask better questions of whoever you see next. The link is in the description, and I have got it on the end screen for you. I am Dr. Tim Batista. Stay healthy, share your smile with others, and I'll see you in the next video.